Hi, my name is Ann Edenfield-Sweet. I'm the Executive Director and founder of Wings for Life International. And today, this is workshop number 6, where we're learning about community health workers and certified peer support workers and OPRI. So I'm very excited today. We have Jamie Slama, who is the statewide director of the Office for Community Health Workers. She's going to tell us all about this program and why it is so important for all of us to know about it. So welcome, Jamie.
Hi, everybody. It's a pleasure to be here today to talk to you about what I do. I work with the Office of Community Health Workers. I'm the statewide training coordinator / certification coordinator. I've been with the office for going on 5 years now. We're doing amazing things, and today I get to tell you all about them. First, I want to give you a little introduction of what a community health worker is. A community health worker is a frontline health worker in our community. What that means is that these are individuals that are from their communities that go in and work either in a healthcare setting or a social service setting. Their jobs are to be the bridge between the healthcare system and the outside community. So for instance, they go in and they determine what the needs are in their community and how they can assist their communities, whether that be with social services or if they have policies that they want to change in their communities, or where there is something, say they want more parks in their communities. They go in and they rally for those parks to be put in place. Or if there's too many liquor stores on a corner, they go in and they fight for them to be removed if they feel that it's an issue in their community. So these are just some ideas of what a community health worker does and the communities that they serve. Today I'm going to touch base first on how to become a CHW. What does that look like? So the first thing I wanted to say is there's 2 pathways to becoming a certified community health worker in New Mexico. The first pathway is through grandfathering. It's a process in which we use your work experience prior to May 21st, 2014. That is when the New Mexico statute was passed. And so anybody who has worked as a community health worker or promotora before that date are eligible to apply for certification. The second pathway is through our core competency training. Anybody that is 18 years or older can apply for state certification through core competency training. We have different organizations, community colleges here in New Mexico, and high schools like New Mexico High School Leadership that do this training. The only requirements to apply for training is that you have to be 18 years or older at the time that you apply for state certification. So you can go through the training as young as 16, but in order to apply for state certification, you have to be 18 years or older, and you have to have either a high school diploma or a GED equivalency. Once you get state certified, the certification lasts for 2 years. In those 2 years, you're required to complete 30 CEUs. 15 of those have to be DOH approved continuing education courses, and the other 15 have to be self-select. So anything that you choose that is interesting for you that you want to take a training on, we are more than happy to accommodate you and any type of learning that you are interested in. One really cool thing about New Mexico is we're one of 4 states that actually have the opportunity to have specialist community health workers, and we recognize 3 specialties in New Mexico. So you can get a generalist community health worker, or 1, 2, or 3. I'll touch base on that more in just a second. Applying for state certification. In New Mexico, we have an application fee of $45 to apply for state certification. Again, if you apply through grandfathering, you would have a couple of different things that you have to do. You have to actually submit 2 letters of reference and proof of your volunteer work or work experience prior to that May 21st, 2014 date. If you're applying through core competency, you would submit your certification that you've achieved completion of that 100-hour course. The 100-hour course is based on 10 core modules of a community health worker track. 11th one is an optional track, which is clinical support skills, and which that means is they learn basic clinical skills such as taking a blood pressure or temperature or maybe even a diabetes check. With applying for state certification in New Mexico, you're required to pass a background check. Don't let that scare you, because we have people that have a hit on their backgrounds, but that doesn't mean that they aren't eligible to be certified as a community health worker. What that means is we have a review committee that we take that background check to, and they decide whether or not you can be certified. And I can honestly say only 3 CHWs in New Mexico that applied have not become certified. So that's not very big and large percentage, considering we have 376 certified CHWs. Again, so the levels of certification. The first one is the generalist. Like I said, it's just going through that 100-hour course, or you're grandfathering in based on your work experience alone. An S1, an example of that would be what we're going to talk about today. Besides what I do, we're going to talk about peer support workers and community support workers. So that other certification would fall under being a specialist 1. We recognize 3. We do not choose the 3 that you choose. You can use a CPS worker, you could use diabetes, you can use asthma. It's totally up to you. One thing about getting a higher level CHW with certifications as such as 1, 2, or 3 is that whenever you go to the doctor, you're getting education. So their job is to educate you on the chronic disease or social services that you're needing. So they're very highly trained individuals. I'm going to leave this up. This is our contact information. Just in case you're interested on finding out how to learn more about a community health worker and what they can do for you. It's as simple as Googling community health worker or CHW in New Mexico. You can Google it and you'll pull up the office and it'll give you a lot of great information on where you can find them. But the majority of community health workers here in New Mexico are anywhere from social service such as housing departments, if you need assistance with your electrical payment, or you're behind on your rent, community health workers can help you navigate through that system. Also, the most common areas that community health workers are in the ERs throughout New Mexico, whether that's through UNM or Press or Loveless. There's always a community health worker in an ER, and their job is to help you connect. So what for? Well, we don't want you using the emergency room for non-emergency services, so we put community health workers in there for a reason. If we can prevent you from having to go to the emergency room, that's what we're going to do. So that's enough about my office, and now I believe me and Ann are going to have a conversation.
Well, thanks, Jamie. Have a seat here. Yes, I've got some questions because I am still curious about this, and I'm sure the listeners are too. So, first of all, it sounds like you've got a lot of these community support workers, 376, and you could find them in an emergency room. But if somebody needed one just to go out and help do diabetes tests, the asthma, the blood pressure that you're talking about, how do they go about finding somebody that would be able to do that for them?
Yes, so we're lucky enough in New Mexico to have a database. So we have all contact information for all CHWs here in New Mexico. And my job is to link you to a community health worker in your community.
Okay, so they would get in touch with you, the contact information you've given us.
Yes.
And then are they located all over the state?
They're located in every coordinate in New Mexico, so every quadrant. Every county except for one has a community health worker.
Really?
Yes.
Wow.
And I would highly recommend them starting with their insurance, if they have insurance, if they have Medicaid, because all MCOs here in New Mexico have employed CHWs as well to help them.
Okay, so you're talking about Presbyterian, you're talking about Western Skies, and Blue Cross Blue Shield.
Absolutely.
Okay, so contact their representative there for a starter. They could find one in the emergency room. Then they could also contact you.
Yes.
And then because they're placed all over the state, they actually could come out to their house and help them.
Absolutely. Some of the services that they provide is they can take them to and from appointments if they need that.
Wow.
They can actually go to their house, check their blood pressure, check them to see if they have diabetes at their home. If they're having trouble breathing, they can assist them at home. Those are just some very minimal jobs that they do.
Now, do they work with the entire family too? So children, if they need help with their children as well?
Yes, there's actually CHWs that specialize in children. Through CHI, through St. Joseph's, that's their job, is to work with children that are under the age of 6 especially, but they work with all children.
Okay. Oh my gosh, this is really wonderful to know. Now I know, so you're talking about the health workers, but also I know the same thing goes for the certified peer support workers.
Yes.
And tell us a little bit more about the commonalities between the two.
So the only difference between a community health worker and a peer support worker is peer-to-peer is they have to have had some sort of substance abuse addiction or opiate addiction. And with a community health worker, you don't have to have that. The difference is that they both come from the communities that they serve. So a CPSW is someone who's went through addiction, right? And so now they're trying to help somebody who is going through that as well. Whereas a community health worker is, they're in their communities helping their communities. That doesn't mean that they've had an addiction or a substance abuse issue, but that they know their communities because they're from those communities.
Because they're from that community. Wow. And so I'm curious, because you're doing this, and it really sounds like a fabulous job, and you talked about ways that somebody not only could get someone to help them, but also they could get a job. What's your favorite part of the job, or why do you like what you get to do?
I get to help people every single day. I became a certified community health worker because I had a community health worker whenever I was 16 and pregnant, and I went into the HSC office, and it was very hard for me. And she made my life a whole lot better. She gave me all the assistance I could need and possibly want, and after that day, I wanted to do the same. So I get the privilege of training community health workers to be that amazing every day.
Oh my gosh, so in a way, you're a peer support worker too, because maybe you're working with a pregnant mom, maybe you're working with somebody that has had some difficulties in their life, but because of what you've gone through and how somebody helped you, now you're giving it back.
Absolutely.
Paying it forward.
Absolutely.
Wow. Well, I just think this is fabulous. What a great program. So if you are listening to this program, my gosh, get in touch with Jamie, get in touch with Opry, get in touch with the certified peer support workers, because they all care. I know so many of these folks, they care, they're here to make a difference. It's a free program for you, so please contact them. We hope you've enjoyed this workshop. And I hope it's been helpful, and I sure hope you're making some phone calls. So thanks so much for joining us today.